twitch there, that's completely normal. Capture. Aspirate.
Right, clear.
Clear, inject. There's pressure again, Reg.
Hi, I'm Dr. Shauna Springer, and I'm the Senior Psychological Advisor for Stellate Mental Health.
My name is Courtney Janes, and I'm the Executive Director of the Infinite Hero Foundation. Infinite Hero exists simply to connect our military, veterans, and their family members with innovative and effective treatments for service-related injuries.
One of the areas that I'm most passionate about is working with military veterans, service members, and first responders.
My name's James, prior service United States Marine, OIF combat vet.
Richard Hawkins, 377th Security Forces Squadron, Air Force, out of Kirtland.
I'm Daryl, retired Marine Corps infantryman, was an Air Force aerial gunner with 129th Rescue Wing, and as a firefighter, City of Santa Rosa.
One of the treatments that few people have heard of is called the DSR SGB. Now that stands for Dual Sympathetic Reset, Stellate Ganglion Block. Ganglion is just a cluster of cells, and we have different ganglions, ganglia throughout our bodies. And the stellate ganglion is a cluster of cells in the neck area. So there's a cluster that looked vaguely star-shaped. That's what stella means, star. So the stellate ganglion is right here in the neck, a few inches above the collarbone. And what we do with the DSR SGB is inject ropivacaine or bupivacaine, so basically an anesthetic like Novocaine that you get at the dentist, into these two clusters of nerves, and it numbs the nerve clusters and resets the fight or flight system.
Well, yeah, I mean, I'm going to stick a needle in my neck, so I'm kind of like, it's like, yeah, not my favorite thing to do, so we'll see. Hopefully it works.
Walking in here today, the anxiety was high. I definitely had my doubts. I was expecting maybe some kind of pain or this to be far more invasive than what it actually was. And I sat on that table waiting for the moment where they're like, okay, here we go. But it was like, okay, we're done.
What happens is the anesthetic goes in, it kind of bathes the cluster of nerves in this medicine that resets the fight or flight system. My first patient was actually back in the VA back in 2016, before I was working at Stellate Mental Health. And what happened with that first patient has happened over and over and over with many more patients and veterans. And they say similar things after this procedure. I've had many patients immediately break down in tears of relief right after the procedure and say things like, it feels like someone just took a 1,000-pound weight off my chest.
Once the medicine starts to go through, you can kind of feel it pretty quickly. It's like a calm, not an overwhelming calm, but you relax. And it's like being zen. The only time I've really ever felt that way is when I'm on a dive tank and been underwater, because I'm able to find my neutral buoyancy point, relax, and probably the pure oxygen helps.
When you're chronically stuck in fight or flight, something happens that's called foveal vision, where it's like fight or flight tunnel vision out of the fovea or center of the eye. And when you get treated, a successful treatment will often expand what you can take in. It will make colors feel more vibrant in the room. And often the effect of this is very quick. Most people feel some positive shift within minutes of the procedure.
Way less invasive, way less stressful. It was actually pretty pleasant. And couldn't stop laughing when I sat up on the table. And it felt good.
I would definitely recommend it. The advice would be, it's going to be more in your mind than it is in your body. It's 2 pokes, you don't even feel them. I was more concerned about the pain or the onset or the twitch from being stuck in the neck by a needle, right? But nah, I really relaxed, breathed, and just.
When we look at the landscape of our veteran care, it's not a one-size-fits-all situation, and Infinite Hero believes that we need to be doing more, focused on being at the forefront of what recovery looks like, investing in innovation, investing in those programs that we believe will move the needle on healing and recovery long-term. So we focus on suicide prevention, brain health, physical rehabilitation, family support, and leadership development. Infant Hero was founded in 2012 by Colin Baden, who at the time was the CEO of Oakley. We are proud to be in the space we're in. It's a very unique space, but we get the chance to work with programs like the Stellate Mental Health and the Sabot Foundation. We believe strongly in collaborations and partnerships, and this is one of those that we're very excited to see the outcomes and very proud to be a part of.